Okay. Welcome, Dr. Dennis. Good afternoon.
Good afternoon. I hope you can see me. I am very sorry.
Yes, I can.
Yes, we can.
I'm very sorry. Everything goes wrong when you're about to come online. All right.
We'll be waiting for Ronsi. I think he's also having an issue joining. So after which we can proceed.
Awesome.
Sorry for keeping everyone waiting. Once we have Ronsi joining, then we'll go ahead and start. So we'll be starting in 1 minute. Once again, I'm saying a very big thank you to everyone that has joined this webinar. I'll be handing over to my colleague, Dr. Toluwanimi, who will be welcoming you all and introducing the moderator for the day. Thank you once again.
All right. Good afternoon, everyone. Please confirm that you can hear me.
We can hear you.
All right. Good afternoon, everyone. I am Dr. Toluwanimi, and I'm the program's intern at the Foundation for Cancer Care, which is the non-profit arm of Lakeshore Cancer Center. This particular World Cancer Day webinar was put together in collaboration with Lakeshore and the Foundation for Cancer Care. And like as we all know, the World Cancer Day is that day where everyone, home and abroad, lends their voice to cancer care, cancer awareness, and advocacy for cancer in general. So today we'll be exploring the topic, closing the care gap, challenging those in power. And we have an array of speakers that will be speaking to different topics regarding cancer care in Nigeria and globally. Moderating this panel session is Dr. Dennis Ejo, and she's right on this call. I'll just do a brief introduction of Dr. Dennis. Dr. Dennis is the CEO of Coromorant Cancer Foundation, an NGO that was founded after the death of her mother. And at the moment, what she does is she hosts 2 programs on the African Internet Television called Kakaki Cancer Awareness, and another one called Cancer with Dr. Dennis Ejo on Plus TV Africa. With us today is Dr. Dennis Ejo, and she would be moderating the panel sessions. As much as possible, please, I would like us to be in this webinar, participate, and give us a maximum response as we go ahead. Over to you, Dr. Dennis. Thank you for coming on board.
Oh, hello, everyone, and thank you very much. It's a privilege, actually, to be here. I hope the sun is not in your face. If it is, I'll make an adjustment, but I hope you can see me clearly. Everyone, welcome to this thing. I am actually speaking on behalf of Lakeshore Cancer Center and the NGO in charge. So let's go. What are we talking about? We're talking about closing the care gap. Together, we challenge those in power. I hope that those in power are sitting with us so that we can actually have a fantastic conversation and look at what it is. I live with cancer. I live with metastatic breast cancer. I have been on this journey for 7+ years. I have had 13 tumors removed from my brain, and I am in active treatment, and I've always been in chemo. So I'm hoping that all those speaking would, I think most of them know me already, so we would have a very good, and I hope we have a very honest conversation. And in the room today, we have, now I'm going to say, let me just give out some quick things, because I have one person who is supposed to talk. Oh no, so I'm the one that is doing it. No. Precious is going to give us an introduction of our speakers. So Precious, over to the speakers for the first set, please.
Okay, so we'll be going into our first panel session with the topic being the cancer care landscape in Nigeria. And our panelists are Dr. Pamela Ajayi. Dr. Pamela Ajayi is an exceptional leader in the healthcare and is currently the president of the Healthcare Foundation of Nigeria. And she will be leading us today as in the first panel session, while the second panelist is Dr. Adamu Alassane Umar. He is currently the NCS chairman as well. So it's great to have these people here who would love to hear more from you today. Thank you.
Thank you, Precious. I think it's time for us to start the conversation. And so let's start this conversation with Dr. Pamela. Dr. Pamela, how are you? Welcome. Can you hear us?
Yes, I can. Thank you very much. I can hear you.
Oh, yes, and we can see you now. Awesome. Okay, so we're looking at policy perspectives, and I think that's one area that I don't think anybody would fault on saying you are good at this. So let's go. The focus is the policy perspectives, government initiatives and policies, and areas needing improvement. Can you talk us through this as we are today in Nigeria?
Thank you. So, thank you. It's a very important question. I know that there are a lot of sort of anxieties, but I must tell you that a lot of work has been done. The National Institute of Cancer Research and Treatment has, during the last Cancer Week, which happened last year, launched 2 very comprehensive policy documents. And I know I don't have all the details of what is inside those 2 documents, but I know it includes certain important things such as cancer registries, which are very important to establish and maintain cancer registries, to monitor trends, to identify disparities, and to guide targeted interventions in specific demographics, like in our own area. A lot of work has also gone into research funding, and there's an increase in government funding towards this. And I'm also aware that the number of issues such as health education initiatives have been put in place. And very important is the issue of the Cancer Health Fund. That is an area that has actually been put into the hands of the Nigerian Institute of Cancer Research and Treatment. And the aim is to also develop policies to make cancer treatments more affordable. And I know they're working with certain drug companies such as Roche, etc., to try and do this. Now, a lot of things need to be put in place. So, for example, we're talking about accessible screening programs. We're aware that places like the UK, for example, and other developed countries have various, established screening programs for cancer, for breast cancer, with mammograms, for cervical cancer, with pap smears, and so on. And while some of these things are available, they are not available free in our countries. And I think these are some of the things that we need to look to them towards establishing. How can we establish some of these screening programs free of charge and ensure things such as, culturally acceptable patient navigation programs are developed? there are, there's been an increase, obviously, in healthcare infrastructure and treatment, which is excellent. There's been investment in cancer treatment equipment in various teaching hospitals, but as we know, it's not enough. It's not enough, but I also think that
Dr. Pamela, are you still here?
I think we lost her.
I think we've lost her. Yes, I think we've lost her. I actually had a few questions for her already on our ways forward. Okay, so I think what we're going to do is let's hope she comes back on, but at the same time, let us continue the conversation and see what we have next. Dr. Adamu, are you ready for us? Dr. Adamu, are you ready for us?
Yes, Dr. Denise, I'm here.
We have to make sure that you guys can hear us. Thank you for joining us this afternoon. And thank you for your time. Okay, so Dr. Adamu is the head of, I would say to him, is our own president of the Nigerian Cancer Society. And today you're going to be talking about advocacy. Have I been able to get
Pamela is back.
Dr. Pamela back?
Sorry, I didn't know where I dropped off. I apologize. The network went off.
Okay, you dropped off where you started to explain about the new policy, the policies, the actions from the policies that had already come out.
So right at the beginning?
Almost right at the beginning.
Had I spoken about cancer registries, research funding, and health education initiatives?
You were just getting to that.
Oh, wow. I had really gone far when my discussions. I didn't realize I had gone off. Apologies. So I was talking about...
Yes.
Go on.
I was talking about the fact that, there were cancer registries, research funding, health education initiatives, the Cancer Health Fund being established for affordable treatment options. And I also spoke about the fact that there's been a lot of investment in equipment and infrastructure in cancer care, but it's not enough. We still need more. And I also spoke about the fact that we need public-private integration so that a patient can go to either a public center or a private center to access care. And we need to find a way to ensure that this crossover is established, because it's very important that our patients receive the care they need, and a lot of private centers can actually achieve this. Very recently, just the end of last year, as the Healthcare Federation of Nigeria, we actually had a webinar to showcase some of the potential and that is available, the excellent facilities that are available in the private sector, of which Lakeshore, of course, was one of the establishments that was showcased. Now, what are the other things that we are talking about? What are the other things that are important in terms of strategies that need to be put in place to close the gap in cancer care when we're talking to the government? We're talking about equitable access. Equitable access means we need to prioritize policies to ensure that all populations have equal access to cancer care resources, which include things like screenings. I spoke about screening, the fact that it's important to have screening programs, affordable screening programs, if possible, free screening programs, and access to treatment and support services. We need to have community outreach programs, because a lot of our underserved populations are not even aware of the kind of things that they need to know about, in particular, as providing education about cancer prevention, the kind of symptoms and things that people need to be aware of to ensure they get early diagnosis and can access the treatment. Our country is a large one. Things like mobile clinics and services are important, as is the issue of technology integration. We have an issue, of course, on ground with a lack of, or shall I say, yes, a lack of actually qualified oncology personnel to go across the country. So how can we, overcome this? We need things like
Network again. I think Dr. Pamela has gone off again. Before she comes back on, I would like to acknowledge the presence of Dr. Zainab Agudu. She's the CEO of Medicaid Foundation. She won't be speaking today, but we are happy to have her as part of this webinar. Dr. Zainab, welcome.
Thank you. It's a pleasure to be here. And I look forward to hearing from the distinguished panelists. Thank you.
Okay, we look forward to having you here. So hopefully you'll be able to contribute in this conversation, knowing
Yes, I
your
will.
experience on this field.
I will. Well done.
All right, thank you. Over to you, Dr. Dennis.
Okay, we've lost Dr. Pamela at the part where we really needed to hear from her. Areas needing improvement, and she'd started that. I don't know if we're going to see if we can try, but listening to what she has to say, it's very good to be able to recognize and applaud the progress that has been made so far in the cancer space. A lot of us that have been on and have met a lot of people on have continued to see progress, and the new structures in place are awesome, in my view, based on where we were coming from. So I cannot fault that. I'm trying to see if she comes back on. If not,
I think she's
I'm back on. I'm so sorry. I don't know what's happening with this network issue. It's really quite stressful. I'm so sorry that it keeps cutting off. I was talking
Pamela,
about.
hold on a minute. Can I just ask people that are handling this, can you make sure I can see, because I don't see her when she comes back on. So I don't know.
Okay, I pinned that to the screen, so
All right then.
you can see it just right under.
I can now. Dr. Pamela, go on. You stopped at areas of improvement.
Well, had I spoken about equitable access
That was where,
to
yeah.
financing?
Yes, you have.
Okay.
Yes, you have.
Yeah.
Okay, how about mobile clinics and
Yes.
Yes,
technology
you mentioned
integration?
technology integration. Then you were on lack of qualified oncology personnel to go across the country.
That was where you stopped.
Yes, yes, that was the issue, is that the issue of personnel cannot be overemphasized. The Jacques syndrome is something that has affected all of us. And of course, you know, training and development of oncology personnel, I'm not just talking about doctors, but specialty nurses, etc., takes a long time and is a huge investment. So how can we overcome this? So the issue of technology integration is what I was talking about. How do we leverage technology to facilitate remote consultations, telehealth services, and health monitoring, which are in particular, you know, beneficial for patients in geographically isolated or resource-limited areas? I also spoke about the need for culturally tailored intervention. We are a very diverse country with, you know, diverse tribes, cultural issues, language barriers. Community-specific needs need to be taken into consideration to ensure that we enhance the effectiveness of cancer care initiatives in different areas. Now, we talked about the Cancer Health Fund, but that's for people who are financially disadvantaged. We also need to talk about financial assistance programs, the introduction of assistance programs to alleviate the economic burden of cancer care, which include things like subsidies, insurance support, and assistance with out-of-pocket costs. These are just some of the areas. I've spoken already about, you know, health literacy campaigns. We talked about the workforce, but another very important area that we need to talk about is access to drugs. With the exit of multinational pharmaceutical companies, the cost and accessibility of cancer drugs is an issue. It's not a theory. It's actually an issue for everyone, and even more so for some of these really expensive drugs. And the government really needs to identify pharmaceutical companies who can actually produce them. A lot of our pharmaceutical companies in Nigeria actually produce very generic drugs. Research needs to be put in place, and, you know, a lot of financing to ensure that our local production companies can actually start to produce some of these more specialized drugs. I think these are just some of the things that I think would go a long way towards closing the care gap in cancer in our country.
Thank you, Dr. Pamela. That was actually very interesting to listen to, and I think most of the points have been picked up. So I'm going to try and throw this from the perspective of we that live with this disease. And the truth about it is the title actually helps me to know that that is what we're going to be looking at, and that is together we challenge those in power. I want to challenge those in power, and I'm going to ask this question. Okay, the policy perspectives in the cancer work is making progress. We accept that. From the space of a person living with the disease, I can speak from that point of pain, or I'm going to speak from the point of pain, how we feel. And the question I have is that, does the policy document reflect the experience of patients in question? And where am I coming from? I'm coming mainly from funding. And I'm going to make a statement most people don't like me saying, but I'm going to say it. Cancer patients are the most expensive beggars in the world. Doesn't matter what country you are. Once you have cancer, you can't, the cost of cancer is very, very high. In your knowledge of this document, how has this document been able to start looking at how it's going to elevate the challenges of cancer patients?
I think we lost Dr. Pamela again.
Okay, I know
So-
who can help me answer that question, who is on. Dr. Zena, please, Her Excellency, please, can you help me?
Sorry, so summarize your question. I heard the part about cancer patients needing a lot of assistance in her knowledge of the documents. How can it be elevated? Summarize it for me again, please.
So basically, I'm recognizing as a cancer patient advocate that yes, a lot of work has been done. Thank you. And in the space of those that live with it, especially people like us, a lot of people don't want to accept that cancer patients are the most expensive beggars in the world. That is known statistically. And
Yes.
my question becomes, in this document or in these policies, how much is being taken into consideration in helping us survive? And survive doesn't just necessarily mean funding for medicine, because our lives are not just about medicine. Our lives still matter.
I think that's a very wide question, because you're not only asking about cancer treatments, which is being addressed in maybe silos and in together with the government and other civil society, financial institutions. Like you said, the burden of cancer is very high. But how do we begin to even alleviate some of the problems? That is the main aim of all the assistance programs. They might not directly address other needs that cancer patients might have, but they certainly do address the economic burden that is associated with cancer treatment in terms of medication, radiotherapy, surgery, and those three modalities in particular. So the whole aim is to address these issues, and we can only continue to advocate for more and more involvement by everybody. We're very fond of saying government alone cannot do it, but when it comes to the actual action, or even in meetings like this, all we talk about is how governments can intervene and what government needs to do and so on. By all means, the primary responsibility lies with the government, and I'm not saying this just because I have some association with government, but we must find a way to ensure that insurance reaches everybody, not just for cancer, but even for malaria and other ailments that people are facing on a daily life. Without health insurance and universal coverage, then it's going to be very difficult for us to, or it's going to be impossible for our population to care to their health needs.
Thank you, Dr. Zainab. Thank you. I put you on the spot there, and you really helped me to move this on, because Dr. Adamu is going to be building on what you have just said now, and it is a collective. I mean, I wanted to start this conversation so people understood that it is about the person and the service provision that is expected to help them survive. So let's keep going. Advocacy efforts. Thank you, Dr. Zainab. Thank you. Advocacy efforts. Who have we got now? We've got Dr. Adamu. Can you hear us? Confirm, please.
Yes, loud and clear.
Awesome. Now we can see you. So you're going to be talking about that, and I'm going to ask you to talk us through just 5 minutes of the role of advocates in bridging the care gap and maybe successes and challenges that are associated with this experience or with this work that you do.
Yeah, thank you very much, Dr. Ejo. Thank you very much to the team at Lakeshore Cancer Center and Foundation for Cancer Care, the non-profit arm of Lakeshore Cancer Center. A very good evening to Her Excellency, Dr. Mrs. Zainab Shinkafi Bagudu, our grandmother in cancer advocacy on the African continent, a board member of the Union for International Cancer Control and founder of Medicaid Cancer Center and Medicaid Radio Diagnostics. Good evening to all distinguished personalities on the call this evening. I bring to you warm greetings from the Nigerian Cancer Society. Yes, let me start by saying this regarding the advocacy efforts at closing the care gap, the cancer care gap in Nigeria. Most of these common cancers, when we look at breast, cervical, prostate, statistically, 30% of most of these cancers are preventable. And another 30% treatable, of course, when detected early. Majority of childhood cancers are amenable to treatment when detected early. So we're talking about over 60% of most cancers either being preventable or treatable. What is the keyword there? Prevention, which is better, safer, and cheaper than cure. Then we talk about early detection. Now, the non-governmental organizations, the community-based organizations, and the faith-based organizations that are spread all over this country are working around the clock to ensure that awareness is created, because awareness creation is something that you can do with even very minimal resources. And awareness is the key ingredient that will ensure preventive measures, healthy lifestyle by the populace. Then when you talk about early detection, the myths and misconceptions that Dr. Pamela talked about are widespread all over the country. And it's only through education that we can address such. And again, advocates play a greater role in ensuring that the necessary awareness is created all over the country. This is in addition to the, well, I cannot say skeletal, to the fragmented interventions rendered by non-governmental organizations all over the country in the form of screening, in the form of direct intervention to patients, you know. So all these little efforts we see all over, the cumulative effect of these efforts are what translates to the role of cancer advocates in closing the care gap. Now, the UICC in the year 2019, 2020, and 2021, for 3 years, we worked with a team of I Am and I Will. And the I Am and I Will theme for the World Cancer Day is all about taking ownership of the fight, taking ownership of the advocacy drive to improve cancer care. For 3 years, we took ownership, we prepared, we engaged, and we made sure that we made all the necessary knowledge available to policymakers so that they can understand. Now, beginning in the year 2022, 2023, and now we are in 2024, we have been talking about closing the cancer care gap. The role of advocates in closing the cancer care gap, in addressing the health inequities that exist in our environment, especially in low and middle income countries like Nigeria. Nigeria being the largest country on the African continent, boasting of over 250 million citizens, with an out-of-pocket expenditure of over 85%. 85% of Nigerians pay for healthcare out of their pockets. This further buttresses the fact mentioned by Her Excellency regarding universal health coverage. Without universal health coverage, we are not going to go anywhere. The National Health Insurance Authority Act that was amended over a year now, and we are still talking about universal health coverage. In that act, health insurance is now compulsory for all Nigerians. But we are still battling, we are still struggling to see how we can implement, how the National Health Insurance Authority that is now an autonomous agency can implement universal insurance for all Nigerians. That is where, as advocates, we are pushing, we continue to push so that the necessary thing will be done. Dr. Pamela, during her statement, opening remarks, mentioned beautiful documents that are emanating from the government in terms of policy documents. That is one sad story that we have in Nigeria. We're a country that is full of beautiful policy documents. But when it comes to implementation, that is where we have the major problems. And as advocates, this is where we are very comfortable and happy now that we have a brand new institute that is close to a year old now, the National Institute for Cancer Research and Treatment, whose implementation came about as a result of advocacy. For those of us on this call that can remember, last year, ahead of the World Cancer Congress in Geneva, we had a contestant from Nigeria contesting for the post of the president of the UICC, in the person of Her Excellency Dr. Zainab Shinkafi Bagudu. A letter emanated from the presidency supporting her bid to become president of the UICC. And as a result of the advocacy efforts we put in there, Her Excellency was able to extract a position statement from the presidency, committing to the fact that the National Institute for Cancer Research and Treatment will be implemented before the end of that tenure. Don't forget, the act was signed into law over 5 years ago. And lo and behold, we now have a new institute. So it is expected that as advocates, the push and then the continuous movement in the positive direction will enable these beautiful policy documents emanating, especially from the new institute, to become reality. So, but the reality is that when you talk about challenges, Dr. Dennis, cancer NGOs in Nigeria, or by extension, cancer advocates in Nigeria, are faced with a lot of challenges. Every day, on daily basis, people believe that as a cancer advocate or as an advocate, you can just place a phone call for their problems to be over. Dr. Dennis, I can relate when you are talking about the sufferings that cancer patients go through and the characterization that they are actually the most expensive beggars on the planet. I am not a cancer survivor, but working with cancer patients has given me the knowledge, the understanding of what cancer patients are going through. And it is only as a result of our sustained advocacy that we can be able to address these gaps. So we are rounding up the World Cancer Day 2024 by still talking about closing the care gap, by still talking to powers that be, by still talking to policymakers on how best we can improve cancer care, and of course, by extension, other aspects of health in totality. I am very happy Her Excellency is on this call, because when we are talking about engaging the powers that be, when we are talking about engaging policymakers, she will be very critical to us. Because we are not only talking about Federal Ministry of Health, we are not only talking about the presidency, we are talking about ministries like the Ministries of Finance, where the money comes from. I was on a panel together with one of the senior special advisors to the president last year, where a statement was made that the current administration has earmarked 11% of consolidated budget to healthcare. We were all jumping and clapping during that summit. Because since 2001, when the Abuja Declaration was passed in Abuja, where all African countries agreed under the African Union that they should allocate at least 15% of their consolidated budget to healthcare, Nigeria has been oscillating between 5 to 6, 7%. And like Her Excellency said, without universal health coverage, we will continue to move in cycles. Our advocacy efforts may not yield proper results at the end of the day, because what we need is funding. When the budget for 2024 was passed into law by the National Assembly, when we discovered the allocation is 6%, we were depressed, we were demoralized. But as advocates, we have this belief, we have this optimism that the government can do the needful. So we are still waiting for a supplementary budget that can come to bridge that gap, so that there will be enough resources to go around, so that there will be revamping of more cancer centers across the country, so that there will be grants given to private cancer facilities. Lagos is lucky to have sophisticated cancer facilities like Lakeshore. My hometown, Jakusko in Yobe State, we cannot even start to say maybe in the next 10 years or 20 years we can have a cancer center like Lakeshore. Even the state capitals, where are they? We need to see these sophisticated health facilities all over the country. And how do we do that? How do we achieve that? Government should provide the enabling environment for these investors to come back home and invest, so that we can be talking about universal health coverage, so that we can be talking about implementable policy decisions of government.
Okay, so Dr.
So
Adamu, can I
advocates,
sorry, for time, we have 10 minutes.
Yes.
We've already done like more than the 10 minutes, and I need to ask you a question. And I'm
Sure.
going to ask you a question. Yes, yeah, I know you're very passionate about this
Okay.
topic, and really, yes, we all recognize NICRAT has now started to give us our attention is coming down very nicely now. As advocates, we have to accept, and we need to recognize where things are going well and where people are actually working. I want to say that the Cancer Health Fund, something is happening there, and we have to keep an eye on that. We have to accept that. And I presume now that as advocates, we have a lot of things going on that work for us as a community, which is fantastic. Well, I mean, under your leadership, well, I think I joined just before you became the or something. So we have to recognize a lot of positives have come out and a lot of good things have come out. And if anybody wants to take that away, that would be unfair. We have to recognize that. What I would like to, I'm going to ask you a question. I want you to be quick with this one so we can go to the next person. But I want to say that with all this in mind, I presume now being defined, how do you think advocates now, like you say, we are many categories, we're survivors, we're organizations, different people help to do. How are we going to access? See, this funding matter is not as straightforward as everybody wants to make it. It's very complex. This life insurance, I was just told 2 days ago that I think the maximum is maybe 1 million. 1 million, I don't know how that works and how that's going to help anybody with it. So as the NCS president, I want you to give me very quickly some words of encouragement to advocates to keep this journey and this candle shining bright. Does that make sense? Because I'm one person that I think I'm only alive because I believe in the positives. I don't like us to always focus on what is wrong, but find solutions for how we move forward. So can you help me with something positive that will come out of this segment, please?
Yes. The reality is this: as we aimed, or as we continue with the process of building the largest coalition of cancer advocates on the African continent, here in Nigeria, I am glad to tell you that our minds are very open. We are very optimistic, because for quite a long while, in those days, policymakers are always at loggerheads with the advocates. But this is happening now. This is happening now during my time as the president of the NCS, and I'm very happy about it. For the first time, a government agency, the National Institute for Cancer Research and Treatment, cancer research, cancer treatment, including palliative care and research, everything under one umbrella. The Institute is willing to partner with non-governmental organizations, of course, by extension, cancer advocates, in reshaping, in changing the narrative of cancer care in Nigeria. it has been evidently clear that the new institute is ready to go to work and is ready to work with stakeholders. And that is actually a very low-hanging fruit, having a government parastatal, a government institute ready to work with the foot soldiers advocate. So that is my optimism. And, you know, as an unrepentant optimist, I always see the possibility in every difficulty. So definitely we may be faced with a lot of challenges because, you know, when you are working with government bureaucracy, the cordiality may not be sustained. The cordiality may not, we may be expecting too much and seeing little results, but it is my belief that this harmony, this new dimension will continue, and be rest assured in the coming years, we will begin to see a better statistics, a better data on cancer in Nigeria.
Thank you.
When people tell me that we see a lot of cancer cases now, I say, when you see plenty cancer cases, it means we are working. Because it's awareness that will bring patients to the hospital for screening. It is provision of infrastructure that will give the hospitals the room to diagnose cancer. So in the next few years, I want to believe that we are going to change the cancer narratives, and a lot of cancer care gaps will be closed.
Thank you very much, Dr.
Dennis.
We'll see again if there are any more questions for you, but you're going to promise me that for me to throw questions at you, you're going to be sharp, because time. All righty, everyone. I think Dr. Adamu has said quite a lot, and so let's go into the second panel discussion. And this time we're looking at strategies for bridging the care gap and challenging power dynamics. It's very interesting because if you listen to the starting, it already highlights a lot of the issues that are in the space. And I'm going to pass now to Precious to introduce the speakers for the next panel.
Okay, thank you, Dr. Dennis. It has been quite an interesting conversation so far. So moving to the second panel, before we move to second panel session, I'd like to introduce and recognize the presence of our CEO, Prof. Chumi is on the call. Good afternoon, Prof. Chumi. It's great to have you here. We're hoping to hear from you today. I'm sure you'll be able to answer some questions from Dr. Dennis at the end of this program. Now, moving on to the second panel session, we're going to be discussing about strategies for bridging the care gap and challenging power dynamics. And we'll be having Ronsi Chidebe. He's the Executive Director for Project Pink Blue. And we're going to also be having Professor Ifeoma Okoye. She holds the position of Professor of Radiation Oncology at the College of Medicine. And currently, she's the president and founder of Breast Without Spots. It's a charity organization as well. And we're also going to be having Dr. Kemi Okunyemi. She's the Lagos State Special Advisor to the Governor, and she is also a trained nurse. So I know she'll be having a lot to talk to us about today, and we are looking forward to hearing from each and every one of them. So over to you, Dr. Dennis.
Hello, team, and it's nice to have you on to be talking about the next steps. So you see, let's start to go. I'm not going to say anything till we get into the conversation. I think that's going to be a lot easier, and we'll have our 5-minute slot. So Ronsi, are you ready for me?
Oh, yes, I am.
Okay, hello, Ronsi, how are you? And nice to hear your voice in 2024. You abandoned me, but let's keep going. Okay, well, let's look at the practical strategies and solutions. But I'm going to ask you that. I would have asked the others first, but I think I want you to talk about this so that everything else aligns. So can you just talk us through 5 minutes on possible practical strategies and solutions that we can start with?
Okay, thank you very, very much. Good evening, everyone. My name is Ronsi Chidebe. I'm the Executive Director of Project Pink Blue. First of all, I just want to really, acknowledge Her Excellency, Dr. Zainab Shinkafi Bagudu, who is the founder and CEO of Medicaid Cancer Foundation. and First Lady of Kebbi State. And that was 2019 to 2023. And Dr. Zainab had been a mother to many of us who are all advocates and also, supporters of cancer control. I also want to recognize as well, Professor Fomo Koye, the president of Breast Water Sport, is very strong mentor as well to me. Professor Chumi, Dr. Ajayi, and so many other people here, including the president of NCS, my very good friend, Dr. Adamu. And the champions in the house, I also want to really acknowledge you all and really thank you all for making our time to be part of this. I'm sorry I took a lot of time in really acknowledging, but it's very important and it's really in the culture of Nigeria. So I will be very fast in talking about the strategies and permit me to really use the strategy that I have used that I thought that have worked, especially when you are coming from a non-profit sector. So I could give two and then probably give additional maybe from any other sector. So what I've really discovered is that when you talk about cancer advocacy and you talk about cancer awareness, it's always very important to really understand that cancer advocacy is so different from cancer awareness. But in many situations, people use it interchangeably. Cancer awareness is just primarily talking about when you are really passing out information that is targeted to the general public. At this time, how this information is passed, who passes this information, what is the channel that this information is going out, must be very simple. Some of the strategies we have used as Project Pinglu was really ensure that most of the information we share for the general public for awareness is very simple and in local languages. And we have moved to another level, which is the level of using documentary. So far, we've done 2 documentaries. We have one more documentary that we're doing. We're done with, we have a documentary on breast cancer titled The Champions. We have another one on prostate cancer that was launched, and Professor Chumi was there during when we launched that. We have a new one that is coming up on colorectal cancer. It's titled Blood in My Stool. And I think this is the first time I'm talking about blood in my stool in the public space. It's because we've started filming already. So at this time we can talk about it. It's funded by Global Colorectal Cancer Association USA. And these are very simple strategies that you could really use to reach people in the easiest way you think that the world is going. Today, not just, and I really freak out when people say if you want to hide something good, hide it in a book. I totally disagree. I just believe that this is not an African thing. I think it's a global thing. All over the world, people are no longer reading as they used to read. So let's stop you really saying it's only Africa. So people are beginning to using more digital tools a lot. So for us to really hold on to the general public, we need to begin to think of new and innovative strategies like using documentary, using content creation, using very simple ways that you think people really use. Today, people are no longer reading book as much as they use it on the paper. They are now using e-Bible, e-document, and all the rest of them. So that's one strategy. And all this is really targeted at awareness. Then coming to advocacy, as I said, these 2 words are so different, but although people use it interchangeably. Advocacy, I think in my own perception and in what many scholars have said, advocacy is different from awareness in the sense that advocacy, you are targeting at policymaker. You are looking at system change. So when you say you're an advocate, it means that you are thinking of raising your voice, speaking out to bring about a system change. If it's in cancer, you are really raising your voice to see how policymakers can bring about
Hello, Ronsi, are you still there? Can't hear you anymore. We can still see you. Oh, we seem to have lost Ronsi.
I think so.
I think so.
Yeah, I
Okay.
think so as well.
Okay.
So
As I said, I was just going to take all the three conversations.
Changes that could really, revolutionize. So think about it is group did in.
I think he's having network issues.
I think he
So
is.
we can go ahead with Professor Ifoma. If we can go.
Alrighty. So next,
Okay.
Prof, can you now take it on and let's go with you? What am I going to ask you? I'm going to ask you, and we've got 5 minutes to just give us a brief background of what we're asking, so that at the end we can pull the questions together. And it says engaging policymakers, which is what Ronsi was actually trying to talk about as well. And it's best practice for advocacy again. And if you have any case study, you can share with us. Thank you. 5 minutes for that.
All right. Even though when I was engaged for this, I was told I'll have a 20 minutes presentation, but be it as it may. Good afternoon, everybody. Let me stand on established protocol. Your Excellency, with your permission. Thank you so much. I would like to ask, look at the fact that we are actually looking at gaps, closing the gaps. As we are approaching policymakers, we are wanting to expose to them the remaining gaps. Dr. Pamela talked about some of the advances that has been done. And we can see from the historical review that the NCS president did, that we have also, had some successes in our advocacy, which has resulted in the Cancer Health Fund, as well as the NICRAT. And we are looking at these two successful advocacies that have, translated into policies that are being currently implemented as going to be the game changer that will be able to reverse the negative narrative that has so far dogged the cancer control ecosystem. I would want to say that I believe we've all seen and been daily inundated with the devastating impact of cancer on families all around the world, and the persisting high mortality and morbidity of cancer in Nigeria, which is really driven more by late presentation, in my own opinion, rather than by infrastructural and workforce deficiencies. And the sad truth is that there are some serious gaps in cancer care that are leaving patients and their loved ones feeling helpless and alone, which Dr. Davis has mentioned. One of them is funding and out-of-pocket payment and reducing our cancer patients to helpless beggars. And we are looking at the fact that there is something that we all can do as a collective effort to take proactive steps to instigate change through intentional engagement of policymakers. And we have the power and we have the opportunity to engage with policymakers and convince them to take action. Engaging policymakers to promulgate policies and allocate budgets that will address evidence-based gaps in the cancer ecosystem actually requires a lot of strategic and well-organized approaches, which I hope that I'll be given the opportunity to outline today. However, before I address the strategic approaches, I would like to draw our attention that care gaps in cancer care are not only the exclusive preserve of low and middle income countries such as Nigeria. And literature shows that every day in high income countries, local and national policymakers make decisions that directly influence the care of the patients that directly influence the care of the patients. As a result of sustained advocacy on major policy issues that affect people with cancer. So sustained advocacy is the key word. We must sustain the advocacy. It's not touch and go. It's something that we need to do by stakeholders in the cancer ecosystem. Thank God for the NCS that is mobilizing heavily across board those who are the voices of the voiceless, represented in all the NGOs that constitute the NCS, and professionals that give the management of these patients. If we're to take a cue from the USA, from where we have the major mentors for the Nigerian cancer control space, where our host today, Professor Chumi Nwogu, emanate from, we see exemplary case studies in the current advocacy focus of ASCO, the American Society of Clinical Oncology, which the American Society of Clinical Oncology, which is actually the leading professional organization representing oncologists and other cancer care providers. And I noted that ASCO advocates on a wide range of policy, policy-related issues to ensure that all patients with cancer, that they have access to high-quality, high-value cancer care. And I believe that this is what Dr. Dennis is driving at as she pumps us with the questions, trying to pin us down to say, how are we going to ensure that the lots of cancer patients improve considerably so that the patients themselves can feel the impact? Every time you interact with patients in Nigeria, which we have the platform of the Breaking Bad News project, you will find that the patients are totally unsatisfied with what is being provided at the moment. Yes, some inroads have been made, but there is still a long journey ahead of us. I believe we are quite aware that most oncology practitioners want to benchmark their standards of practice with ASCO recommendations and practices. So it will be good for us to look at the topics where ASCO is focusing their advocacy, because as you do that, you'll be able to compare the care gaps we would also love to close in Nigeria. Number one is access to care. Here, ASCO is advocating for public policy that ensures the following: that access to cancer care and delivery of high quality cancer care should be scaled up for the undeserved, or for the underserved. Number two, that tools are developed to help physicians and patients address the rising cost of cancer care. Number three, that support should be given to efforts to reduce disparities in cancer care and outcomes. And number four, that system changes targeted to maintain and build a strong and diverse oncology workforce should be able to meet the patient needs. And of course, I believe it's Dr. Pamela Ajayi that has alluded to the depleting workforce. In fact, I call it a hemorrhage. Their second area of focus is clinical trials. And ASCO is drawing attention of policymakers to the imperative importance of fostering increased participation in clinical trials. And I must say, sadly, that this is one area that we do have a huge gap, because a lot of times it wants to be forgotten. Making the research system more efficient, prioritizing inclusion of the most promising science, and ensuring adequate reimbursement for the expenses of patients enrolled in clinical trials. These are some of the issues that need to be brought out. Then finally, I want to talk about the drug shortages. Here, we are talking about the exiting of global companies. But do you know that ASCO, from their documents, is showing that drug shortages is the third issue of real concern, that currently the cancer community is experiencing severe and worsening shortages of many critical therapies. So definitely the call by Dr. Pamela Ajayi that we should look inwards and in country and begin to look at the possibility of promoting indigenous drug development. Now, what is driving these drug shortages in the global level? This is as a result of a complex problem with multiple causes related to regulatory and manufacturing issues. Many organizations and advocates have thus, in response to this particular problem, found it necessary to work with policymakers to address these critical shortages and find solutions to help prevent future occurrences. Of course, predictably, federal funding for cancer research, they are continuing to push for this to be beefed up. And because in the past couple of years, they found that it has remained flat. If funding can remain flat in America, how much more, in Nigeria? And they say it's remained flat for more than a decade. And when it is even adjusted for inflation, it's further slumps. They are thus advocating that. I'm rounding up.
Yeah, I just wanted to say so that I can ask you a question after the next. So.
Oh, okay. Okay. So what are the steps? Let me just quickly go to the steps that we as the local stakeholders should put in place. We need to identify the specific gaps. How do we do that? Do we have reliable data? Do we have evidence-based data? Thank God for the the plan that NIPRAT is putting in place is to ensure that we begin to generate our own data and don't rely only on data that is extrapolated for us. So we should build coalitions and conduct stakeholder engagement to develop evidence-based recommendations and be able to produce recommendation documents, and that will be able to enable us to ensure that we have an evidence of a unified voice, as there is strength in numbers. And when policymakers see that there is a collective voice demanding change, they are more likely to take notice.
Thank you very much.
NCS members.
Thank you. Sorry, because of time.
Just one final statement. The NCS members essentially constitute a formidable force any day that can have a stronger impact on policymakers. Let us learn to use them in collaboration with established government establishments so that we will be able to achieve more.
Thank you,
policymakers.
Thank you very much, Prof. And if there are any questions, I'll be able to come back to you on any of the key top things you mentioned going forward. Okay, so I'm going to move on very quickly to the media and public awareness. Dr. Kemi Uyemi, so people with IT, can you please put Dr. Kemi on so we can see her? And Dr. Kemi is going to be talking to us about utilizing media for impact. Can I speak? Dr. Kemi, where are you? I can't hear you.
Hi.
Hello, how are you? Nice to have you on. So Dr. Kemi is going to be talking about media and public awareness. Dr. Kemi, quick question or quick conversation. You got 5 minutes to talk us through utilizing media for impact and building public support. I really like this topic. I really like this topic. So keep going. I think I have some things to ask you as well. Anyway, nice to have you on, and can you please go through? You got 5 minutes.
Okay, I don't even know where to start, but I've heard so much, but everything here that I'll just go straight to media. So I see media as a double-edged, let me say, area in terms of media can break you and media can promote you. So in the context of cancer care, we do need the media. There's nothing we're going to do. We can be advocates till we're blue in the face. You're still going to need the media to promote what it is that you want to promote. So I see media, first of all, media, especially in Nigeria, with the social media, it doesn't matter whether it's print, whether it's film, or whatever it is, media has not really been used in the cancer space positively. And I say that because obviously what I also read in the media, because media is available for everybody. And media seems to be a business. And for me, this is my personal opinion, that media can be bought. Not all media, by the way. I see media as a mixed bag. Some don't do due diligence. They just throw things out there. And then who is media? I'm media because I've got that power of my phone, of my social media. So I'm media. I can contact media and give a story. So going to cancer, we as advocates, and I'm a passionate cancer nurse specialist, passionate, and I have the would I say the advantage and the privilege to actually also be in government, and because I'm passionate, so I'm one of those positive advocates for improving cancer care in Nigeria, especially. So we need to use media to sell our story, to give our story, to make people know, to make people listen. And if we do not do that, other people will do that for us. And I will give you a simple example in Lagos. Yes, Lagos State, we're trying, we're the center of excellence or whatever, but we haven't got there yet. I'll give you an example. So there was the HPV vaccine that was out there. It was out there. They promoted it a bit, but guess what? The anti-vax, the anti-HPV group actually won the media space. You can blame government that why didn't you fight them or whatever. So what happened in Lagos was that we were the second to the last state with the lowest number of people that took on HPV vaccine. Believe it or not, Taraba State was number one, followed by Nasarawa and Abia. Now, what did they do? Because I spoke, what happened? Lagos is supposed to be, hey, we have all these people, because we have too many educated people in Lagos. They're so educated, they seem to know everything. And the media kicked up about how HPV will prevent your children from having, will promote infertility. So that killed it in Lagos. So that's one end. And then you have the media that will say prevention is better than cure, because that is where the government is also going. What can we do within the cancer space to prevent in terms of early diagnosis and healthy living, healthy eating, and all that. So that's one part of it. And then if we don't use the media, they are powerful. If you do not use the media, you're not going to get your people will not be able to get enough information to actually be advocates as well. Patients can be advocates. In fact, they are. So we need to make our lawmakers, for example, very, very accountable. The media during elections, we know how much was spent on media, on TV, on radio, the jingles and everything. That was a powerful, there was a powerful media presence. But can we use them also when it comes to going to our lawmakers? So patients who go on social media or who are on a journey, and I like the fact that you said that you're on a journey, because that is what cancer is. They need to be aware. So I can't stand here, say in my office or in my house, and I talk to people on the phone and say that, oh yeah, I'm being an advocate and I'm making people aware. That's a limited population. But when you use the media to actually push your awareness, push the prevention, push using the churches. The church is a media outlet. And I'm saying, the reason why I'm saying church and local champions, I've got them all written here, is because I do a lot of counseling for patients who have cancer, who are going through chemotherapy. I teach nurses on chemotherapy and all that. And one of the things that I hear a lot of is, I didn't know. So I didn't know, I wasn't aware. My church said this, my local king said this, my friend said this. That's where they're getting their information from. But we can use the media to actually push these things. The lawmakers listen to the media. When you keep on pushing something, they will listen and say, okay, let's get these people, you know, this thing is we're getting bad publicity on this. And then we can sit down and get all these things out. If we do more research, if we do more research and we're coming out with our own data on our own people, on our own biological data, rather than relying all the time on ASCO's results from their research. NCS is there, and I heard the previous speaker. We want to do this. We want to do research. We want to do it, and it does cost money and all that. The media can get involved in whatever we are doing or we are pushing. If anti-vax people can use the media and actually be successful, we can also use the media. And then we can also make the media accountable for good reporting, excellent reporting. That's where I see media coming in. The two, they can destroy you or they can make things bigger. But before I go, please, because I am in government.
All right, go on then.
I am in government. No, I just wanted to say some points because I know I was given 5 minutes, but everybody else has spoken and they've spoken well and all that. Can I just say two things? Well, actually, gaps and challenges. When it comes to medication, the federal government and the state government, they're working together because we need, the drugs are too expensive. So what they're doing now is, I was with the minister and the Pharmaceutical Society late last night, and they were talking about manufacturing the drugs in our own country to bring the costs down. And the only way they can do that is if we have if they reduce the tax burden on people, entrepreneurs or pharmaceutical companies that really want to produce the drugs in Nigeria. So those talks are ongoing. We are going to do something like that. Skills, staff, the issues, diagnostics. You need people who are well-trained. We cannot be getting diagnoses wrong. When somebody comes and they're told, they go to a doctor and they're told, oh, there's nothing wrong with you, that lump will go away. And these are professionals. And then they end up coming to, they meet people like me or the oncologist and they say, no, you've got stage 3, stage 4 cancer. That is a problem in Nigeria. We have all those problems. We we need the media to be really, really push our message, the messaging. That is what the media is there for, to push that message from the advocates, from the government, from professionals, and from patients as well. Thank you. You gave me really, really limited time on something very, very important, but it's okay. It's okay. I'm glad I got the 5 minutes or 7 minutes.
Thank you. Thank you. Yes, you did. You did. I tried as much. I think we ran over a bit too earlier on. And thank you very much.
Sure.
And let's now go on. I think if we look at the conversations, there are a lot of different perspectives, but we all have the same view. We're all trying to come up with a solution, or at least start to look at how to continue to build where we are. So what am I going to do now? We don't have a lot of time, so I'm going to look at some of the questions that we have, and I'm going to try and put them out to us to be able to see who can answer. And some of them are very quick, so I would like whoever is going to take on the question to give me the answer. So first one is, a question came up on the presentations, and it says, do we currently have adequate diagnostic equipment for early detection in Nigeria, especially in immunohistochemistry? I think I would say to whoever it is that asks question, yes, we do. And Lakeshore Cancer Center is one of the places that you can get most of this from. So please check, look around. There is a lot of information on cancer diagnostic equipment. There's still work in progress, but this is available. The next
But
one,
it's expensive. This is the problem. It's
yeah,
expensive.
we're not.
They
Yeah,
need
we're
to get
not.
insurance, health insurance. Get health insurance. There are HMOs. There's Lashma, Lagos State. Get health insurance. Not everybody can go out of the country and all that, but we do have all the diagnostic centers. They're there, but I agree they are expensive. But if you get insurance, health insurance, it will help you and your family.
I think there's a promotion on health insurance, which has also been talked about today. Let me go on to the next question. So the next question has come up, and there has been a rise in false positive diagnostics. Dr. Chumi is on this call, and I think I'd like him to help us with this. Dr. Chumi, how are you? Could you help us with this second question? I'm going to read it to you. It says, there's been a rise in false positive diagnosis, especially in some teaching hospitals in parts of the country. What do you think the government is currently doing to reduce this trend and provide specialist training in oncology health providers? I know your hospital is engaged in this and has been for almost all the time I've had any contact with you. So please, can you help us with that?
Yes, thank you very much. I also want to express my appreciation to all the speakers, the moderator, Dr. Ejo, and everybody else involved in organizing this. Thank you so much for making this happen. I am not specifically aware of this increased false positive rate in government hospitals that is being asked, but I will just make some general comments. We do have an increasing number of facilities. It's very encouraged. We need more. We need to spread them beyond, Lagos and Abuja and the biggest cities. We need to spread this all over the country. We have a big country. I think Dr. Pamela Ajayi mentioned is diverse. We have lots of needs. So we definitely need the efforts. We appreciate what all the advocates are doing, all the NGOs. I always tell patients and colleagues an accurate diagnosis is what is critical to give effective therapy, effective treatment. So we definitely need to up our game in terms of diagnosis. The question that was raised about IHC, that comes to really when that's immunohistochemistry, when you're trying to identify the specific cancer, where it's arising from and things like that. So we have to look at low-hanging fruit and then the more sophisticated things. We have to have, mammograms, we have to have PSA, we have to have, fecal alcohol testing, colonoscopy. So when you talk about IHC, definitely we have a problem there. A lot of our labs send these things out of the country to go and get these results. That's a problem. So we definitely need more of that. In terms of what's happening in the teaching hospitals, because I don't work there, I can't give specific directives about that. But I would say that we do have very capable professionals in our teaching hospitals. We definitely need to equip them properly, maintain the equipment, so that people, when they do biopsies, they can process these things in a timely manner. So it boils down to doing ongoing training. We've already heard about our challenge with manpower, retaining people, encouraging people to stay, or those who are out to come back. We have a lot of challenges, even attracting people back. When they come back, we have issues with providing them the licenses they need to practice. So there are a lot of issues, but we are making progress. I was very moved by what Dr. Damu was saying, that it's not only about negativity, and I think all the speakers have pointed that out. We are making progress. I think if we continue to work together, the key thing is collaboration for us to be able to continue to push this envelope, close the care gaps. So it's training, it's encouraging investment, both on the government side and on the private side, and the government facilities helping those of us in the private sector to be able to expand and bring the care closer to where the patients are. So there's a lot to be said. So I won't take up too much time, but I definitely do express my intense gratitude to everybody who's involved in this effort. It requires all of us putting our thoughts and resources together. Thank you.
Thank you, Dr. Shimia. You've answered most of the questions that actually came up. You summarized on them, so that makes it a lot easier now. I think I want to try and summarize.
Sorry, I'm so sorry. Maybe because I only got 5 minutes and I'm in government. I just want to tell you what the government.
Sorry, Dr. Kemi, there's somebody else
I
had
just
that was
want to
up
tell
before
you.
yours. Please, can you?
Okay, go ahead and do that.
Okay,
then.
so
It's
can
fine.
I? Yeah, thank you.
It's fine. I just wanted. He said he didn't know what was going on in the teaching hospitals, and I wanted to tell you what is going on in the teaching
Okay,
hospitals.
so can we come
wanna
to that
listen to
at the
me.
end, Dr. Kemi?
That's fine. That's fine.
Okay, thank you. Prof, can I hear what you had to say, please? And
Okay, actually, what Kemi was going to address is what I wanted to address, because Professor Chumi had said about the teaching hospitals. Currently, there is a big move that every teaching hospital that is involved in cancer management has to operate through an MDT. If you're not implementing the MDT, you can't even, be a beneficiary of some of the structures that has been put in place to improve drug access, to improve access to treatment. So we have the multidisciplinary team, for instance, in the teaching hospital in Enugu where I work. We have a dedicated breast MDT on Monday, and then on Friday, we have a general MDT for all the other cancers. And we are trying to move on to perhaps put in some other days, taking in cognizance the busy schedule of most of the workforce who are overburdened by the heavy number of patients that they need to see. And for the IHC, the immunohistochemistry, I just came back from Calabar, where the ICS-BCS symposium took place, and there were a lot of workshops, and one of them focused on developing capacity of the pathologist for ensuring that we have, more reliable immunohistochemistry results. I remember the problem we were having in the UNTH for almost 6 months. We couldn't even solve it at a time. Even alluded an area that we need to really skill up the remaining workforce we have in the country. Thank you very much. And I agree with Professor Chumi that it shouldn't be taken out of the country. Yeah.
Thank you, Prof. Dr. Kemi, do you still have anything to add to that now that Prof has answered the question?
No, she hasn't answered the question from Lagos State, if you don't mind. She has answered part of the question. I just wanted to tell you how we're trying to push all the things that we're advocating for. So, for example, the teaching hospital, the last...
Yeah, Dr. Kemi, can I stop you here? Sorry, because I get where you're trying to come from on Lagos. Can I try and summarize as much as we have, because we don't have a lot of time, and then come back on anything that is missing, and then we can put it in, because Lagos is one of 36 states, and in the context of cancer, there are two key spaces have a lot more than the rest of Nigeria, and that is Lagos and Abuja. So please,
and that's what I'm trying to tell you.
Bear with me on this one. Thank you.
It's fine. You only get.
So let me just go through and summarize to everyone. Thank you all for actually being on this space and actually listening and getting engaged. It's very sensitive, and I'll tell you something, it's making my heart just beat, because I'm the one that sits with this disease, sitting on this panel, and I'm listening to everyone and I'm thinking, oh my goodness. All right, so let's go. The policy perspective. Things that have come out of these things that we need to put in place. And let's look at how we need to establish more screening. For me, I believe screening is very key to anything we're going to do in this cancer space. And I'll tell you why. Because if there was screening, I'm sure, I want to believe that I won't be sitting here as a stage 4 breast cancer patient. And it's not because I didn't ask for help. So let's all start looking at it. When we have illnesses and we are being told about them, we need to learn from them. Screening programs, patient navigation is almost non-existent, and we need to accept that. A lot of the time, even when campaigns are being put out, we also have those that bring out the negative campaigns as well. As Kemi has said, Dr. Kemi has said, it's true, it's a fact. when you're campaigning for something, another team is campaigning against you. And that really doesn't help our cause. Increase in infrastructure. I think we've had only 6 centers in Nigeria that actually have access to that fund currently. I don't see why everybody shouldn't have it, but that's things that have still got to be looked into. And this integration with private-public partnership, it's ongoing, and we're ready to recognize that that's happening. Looking at the strategies for closing the care gap, equitable access. I believe all of us have a right to live, and all of us have a right to survive. So please, can we look at that? The technology, the training, and the quality of oncology personnel in Nigeria, across Nigeria. There are lots of action points that have come out. So, but I've got 2 hands up that need to say something, and I would hope that it's going to be specific to all Nigeria, please. Dr. Zainab,
it doesn't have to be specific to all Nigeria, Denise. I'm going to overrule you by
all right, you overrule me, but go on. I want to make sure we all have it.
You have to say Lagos is the biggest part of Nigeria. If we scale up policies from Lagos, we need to hear from what Lagos is doing.
So we want Lagos points. Okay, so I wanted Lagos to do last because Lagos has got the biggest for all of us. That's why I kept Dr. Kemi's own last. Okay, so I get it. Okay, that's why I've kept hers last, because it's Lagos that I understand, and I know a lot of things are going on. So she's the best person to finish for me. Okay, so Dr. Kemi, please bear with me because I know what I was trying to do together. All right, Prof, I won't be able to give you space now at this point. Let me just continue this for a minute. Some action points that have come up. Government needs to empower pharmacos to be able to manufacture the drugs in Nigeria. I think we all agree with that. The insurance policy that's available, I'm sorry to say, is not adequate for every Nigerian. We have to accept that, and there's no need for us to turn it around. It's not adequate. I was speaking to a cancer patient last night, and she was telling me, telling me the maximum you can get is 1 million. 1 million for what? The drug I use every day is costing £10,000. So sorry, I don't get that. But let's keep going. And there's a need for culturally tailored interventions. Correct, I think that's correct. Advocates have been doing quite a lot. Dr. Adumu has talked about a lot of the things that we're doing, and Ronsi was able to differentiate advocacy from awareness campaigns. And those are very key potentials that we all have to look at. Prof has done her own and explained a lot of the key things, looking at the experiences learned from ASCO. So I don't want, time is actually not in our favor. So Dr. Kemi, you have a Lagos model that actually I really want to hear about, because I actually do television. Can you put on your mic now? Because I do television, and I am trying to understand why, honestly, the campaigns on this cancer thing is always negative, and it's not right for us that live with the disease. So thank you. Can you share the Lagos one for us now?
Right. So going by what you said at the beginning, you said you just like action, as in, we know we have issues. There's no point in talking about those. What are we doing going forward? And basically what we've looked at is that it's actually cheaper to prevent stuff than to have a curative model. So we're trying to do this early detection and prevention before we go to curative. However, having said that, we've realized even in Lagos that we need to partner with private hospitals, centers, and people, and bringing them on the table and saying, let's sit down, what do we need to do? So I was talking about LASUF. LASUF is now expanding. LUF also has a private section, and all our patients for example, they all basically go to the only tertiary hospital that we have, and we're expanding the cancer center that is there. That's one. Two, we realize that they're only as big as Lagos, as small as Lagos is. Everybody is coming from every single part of Nigeria. So when you say we want to hear about other people's perspective and all that, but guess what? They're coming to little Lagos, which is fine. And like Zainab has said, it's like, what are you doing in Lagos, so that we can actually do it in all our own states as well, because we have to benchmark from somewhere. So we realize that we need 6 cancer centers in Lagos to actually meet everybody's needs in Lagos. So one of the other things that we're doing is actually bringing the churches, the heads of churches on the table. We're bringing local government on the table. Everybody's an advocate. Everybody on this panel are passionate about cancer care. That is why you have, so many participants right now. So all I'm trying to say is that we need to work together. It's a collaborative effort to get to where we want to be. We're not there yet. There's no argument about that. We need to start. The medications are the worst things ever. They're so expensive, as you have rightly said. But we are going to ensure that manufacturers are able to manufacture these drugs in Nigeria. That's the federal government and the Minister for Health, Professor Pate, has said that that's one of their 4 pillars that they're going to start working on, as in urgent. It's very, very urgent. We're going to use the media to actually educate people on how to prevention. And for those who have been diagnosed as having cancer, please, everybody, get insurance. That's the only way it's going to help you in terms of to mitigate all the rising costs of what's going on in the country. That's all I basically wanted to say. And then we're going to continue with the research and see what it is about Nigeria, where our indices are still a little bit high. They're not where we want them to be. So we are being intentional, and we are talking to other governments of the states. Everybody's coming together to battle this, and the government will listen. They will hear. This is an active. There's an agenda, and it's a renewed hope agenda. And I can tell you for nothing, and I know Dr. Zainab will agree with me, that this current government is out to ensure that our citizens are healthy. They are healthy. They stay healthy, and they get what they need. But we know what's going on globally, so we just have to hang in there and continue to do our part. That's all I want to say, and I wish you all the best as well. And thank you for moderating.
Thank you, Dr. Kemi. As we've all heard, you see, it's one of the best things to hear when you listen to a conclusion of a seminar like this. It is important to always, and I keep going back to it, recognize where you are, look at what you've got, and look at how to move forward. Without being able to do those 3 things, I mean, there's no point having the conversations in the first place. This conversation has taken us across the cancer space, across the pains of cancer patients, and even you medics that serve in this community. We have to accept you have done and you keep doing the right things for us. Awareness, screening, those basic everyday things that stop us from getting to the major sicknesses, or I don't know, the disease, where the disease gets worse. It's better for us to catch everything earlier than when it's later. And that is way cheaper. A lot of things are going on in Nigeria. I want us all to keep an eye on what is going on. Listen to what's going on in the communities, listen to what's going on across the country, and take good best practice. Best practice is what global societies always talk about. We should always use best practice. So I'm going to hand this now finally back to Tolu to tell us who is going to close on this. But I want to say on behalf of myself and all cancer patient survivors across the country, we want to thank you for taking your time. And I say it from the bottom of my heart, for taking your time to make our cry very important, especially in the Federal Republic of Nigeria. God bless you all. We appreciate you. I'm talking for all cancer patients here. And to Lakeshore, thank you. Thank you for using me. I don't know how to do this. So
thank you, Dr.
Who's going to take it from me? Precious, good.
I will. Thank you so much. It has been very, very insightful having all of this. We enjoyed the conversation. Even my team and I, we've been back and forth, and they are really happy that we had all these very important people speaking about cancer care and closing the care gap. It was very, very insightful. We're so happy. Thank you, Dr. Kemi, for your information about what the government is planning to do. And we're looking forward to it. We hope to, see all these things in action. Dr. Adamo, thank you for NCS. Dr. Prof. Foma, I'm so happy to hear from you today. I loved your presentation, and then we look forward to more of these actionable items as well with NCS. And from Lakeshore Cancer Center in general, from Foundation for Cancer Care, which is our non-governmental arm, we're here to say thank you to everybody that attended this webinar. It was fun having you all. We have your questions. We would be responding to some of them via email, those that were not able to respond to on this webinar. Thank you all for attending. I look forward to, we can follow us on social media, LCC Cares and Foundation for Cancer Care. We have a lot of programs coming up. We have our health fair. It's health outreach for everybody. Different providers will be there. It's coming up March 2nd at Landmark Beach. We look forward to having you all there. Thank you, and thank you. Dr. Zainab, I was happy you were able to join. Thank you so much. Prof. Chumi, thank you. Ronsi, thank you so much. If I didn't mention your name, I'm here to say thank you for myself and my team. Dr. Dennis, I'll be speaking with you after. Thank you all, and bye.
All right, thank you very much, everyone. Thank you for joining this session. Please, as we sign out, please let's take the poll. We would like to have your feedback, both for us to do better on our next webinar and for us to see how to plan better. So thank you very much for joining this session. All of us at the Lakeshore Cancer Center and Foundation for Cancer Care is grateful. Enjoy the rest of your day.
Thank you very much. Thank you.
Is the poll coming up?
Thank you and goodbye.
Yes, it's up and running already.
All right. Thank you.
Thank you, everyone. Thank you so much.
Bye now.
All right. Thank you, everybody.
Bye.
Bye.
Bye, 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 Prof. Chumi. Bye, Dr. Zainab. Bye, Dennis.
Bye.
Bye.
Thank you, everyone.
Bye, Dr. Adamo. Bye, Prof. Okoye.